Hello, everyone, and welcome to your YouTube channel, Your Path from BDS to DMD. And as you must be thinking, who do we have today? This is Dr. Alisha, and she recently got accepted to University of Colorado, and she has been kind enough to share her journey with us. So welcome, Dr. Alisha. How are you?
I'm fine, Dr. Jasmine. How are you?
I am doing fantastic, and thank you so much. I know you're busy with your research, and thank you for taking time to speak to our audience so they can learn a few things from you, and you can give them some tips about your journey, share your journey with them, and share your positivity with them.
Yeah, absolutely. Thank you for having me. This has been a good opportunity.
Thank you so much. So let's start with please tell us a little bit about your journey. Where did you do your BDS from, your experience in India, and what you're doing right now?
Yeah. So I finished my BDS in India. I studied in Chennai in this college called Meenakshi Ammal Dental College. And soon after graduation, I did a 6-month advanced internship at the government hospital in Coimbatore, again, South India. Um, then after that, I worked as an associate dentist for about 3 years before getting married and moving to the US. And in the US, I first started off as a dental assistant. I did that for a year before getting accepted into a master's in biology program with research. And my research was dental related, so that kind of helped me, though it wasn't a master's in dental biology, it was a master's in biology. So after doing that, I started applying, and it was my second cycle when I got accepted to dental schools.
Oh, that's good to know. You know what? This is the first time I'm hearing someone with a different master's because mostly every comment that I'm getting these days is either a master's in healthcare administration or a master's in public health. It's really refreshing to hear that there are other avenues. Can you share a little bit about what are you currently doing these days and what made you choose this master's in biology?
Yeah, absolutely. So the reason why I chose my master's was because before I started this whole dental school journey, I attended an ADIA recruitment fair. So this is where they have a group of dental school admissions officers, deans, everyone who's there, and you can meet with them face to face and ask them all your questions. And so that was one of the biggest opportunities I had to talk to them directly. So there was a lot of misconceptions about, exams, doing part one, part two, which steps to do in your masters. Does it have to be, public health or something else? How much assisting versus shadowing? All of those questions I went in with them. So when I met them, especially the people from Colorado University told me, if you just do all of these things to just tick off checklists, then that actually affects your chances of getting in, and it's not going to help you. And the reason is because then it comes across as inauthentic during your interviews. They end up asking you questions like, why you do this? And unfortunately, there are a lot of students who tell the interviewer, because we have to, that's to better our resume and things like that. And that absolutely hurts their chances of getting in. So they gave me multiple options. They said if your GPA is low, that's when you can either take classes, and that could be even in the form of just shadowing classes and taking them just to make sure that you can handle a full course load. If you need more experience, then you can either work in your home country to build up that experience. You can take CEs. That would also, with hands-on CEs, that would definitely help. Or also just assisting other dentists and things like that. So it's a holistic process, and they do actually mean it as a holistic process. So then when it comes to masters, the reason I did a masters was because my GPA in India was low. So I wanted to show that in the US I can still manage a full course load with teaching, volunteering, all of that, and still come out well in the other side. So that's why I chose a master's, and I chose this particular program because it was more related to dentistry. The research I work on is with dental caries bacteria. So it's testing different bioactive agents with this dental caries bacteria and seeing how antimicrobial they are. So that's why I chose this master's versus any other master's, because it still keeps me in the field. And I can also explain that this is a field I'm still interested in. I'm still pursuing dentistry, but this was what could help me become a good student.
Oh my God, Dr. Alisha, I think this is the best piece of advice that you can give to everybody out there who's applying for the CAPIT cycle. And I think one take home, which I always tell my viewers, there's one take home from every video. So this video is what Dr. Alisha says. A, be authentic.
Yeah.
As I always keep advocating, these are professors, some of whom, our age is their experience. So there's no way we can, get away with things with them. So they exactly know what's going on. And number two is attending the ADIA career fair, which was a student event, which really benefited Dr. Alisha. And the third thing, which is most important, is please get into a master's program because you really want to learn something. It's a lot of investment, time-wise, money-wise. In case of Dr. Alisha, she's married, so you have to go with a work-life balance. So please make sure that whatever you're doing and selecting is something that interests you, something that is, genuine, close to your heart, even whether it's public health or healthcare administration, or like Dr. Alisha said, even if you want to do dental assisting, but do it not because you have to, but because you choose to do it, because that's something that really interests, you. Is that, did I sum it the way you wanted to?
Absolutely, yeah. And even if you choose to go the public health route and things like that, make sure it's something you like. And also think about how that's going to affect you later as a dentist in the US. So even if you do like healthcare administration, it's definitely going to help you run your practice later on. So always make sure you mention that even in your statement of purpose, so they know why you're doing that versus just to tick off a checklist.
I agree with you. So just to let our viewers know, I also have a master's in public health and I graduated a lot of years ago. So today I'm hiding my gray hair. But I I enjoyed my master's in public health because that was it helped me learn the entire healthcare system of US, coming from India, where most economy is a cash economy. You go to a dentist, you pay them money and it's done. But to learn about insurance, co-pays, to learn the different socio-economic things that are affecting someone's oral health. And to me, something very important is, oral health related quality of life. So for me, it was something I was passionate about. So now that we have covered a part of what you could do to make your application stronger if your GPA is not what you may think everybody else in that particular cohort has, it brings me to the next most important question is national boards. And Dr. Alisha, can you please, let's get the white elephant out. That's something which everybody wants to know. Could you please share your journey, what books you did, how did you study, and how did, you crack the exam?
So the way I studied was I was still working part-time, so I didn't have as much time. And I also have a family, right? So we don't have as much time to spend on that. But every time I sat down, I gave it my all. I studied dental decks from front to back. Every single card was memorized. For pharmacology, I followed Tufts Pharmacology. That was very helpful. And there were a lot of YouTube videos that also helped me. So things like occlusion, tooth numbering, things like that were easy through a lot of it I learned through YouTube. There were also a lot of Facebook groups which I joined, and they constantly have questions being put forth back, like people just post questions and people would answer them. So that was a good way to revise what I studied. So I would go there and I would see these questions, and then I'd go back, and if I don't know, I'd go through the entire chapter, not just to find that one answer. So doing that constantly for about 6 months, I was able to clear my part one and then another 6 months for part two.
So I think that gives us a good timeline, because I know we have a lot of our viewers who are either MDA students or, who are dentists who have their practices and they're not sure how long to study. Like even for me, I used to work full time, and I think I always say my friends were dental decks and the ASDA release papers.
Oh, yeah. Yeah. The ASTA release papers also, I did those right before the exam. So 1 week I gave just for the ASDA release papers. And instead of going through dental decks all over again, I just did these exams as a way of practicing. But now with INBDE, I'm not sure how that would work because
Right.
it's not the same
Right.
format.
Right,
So
right. Definitely, definitely. I think with INBD, it's a learning curve for everyone, and I'm sure it's the same way that even the people who are creating exam feel, and I feel at the end of the day, they will do justice to the students. I'm confident. So, Dr. Alisha, can you share a little bit about your journey? That why what made you choose Colorado? Because every time I encourage people to apply to schools, I tell them that you have to understand not only is the school choosing you, but you are choosing the school. It's a lot of investment, time wise, emotion wise, financially. So could you please share that with us?
yeah, so I chose Colorado because they are the friendliest university that I've spoken to. And I mean that. Like, we could send them an email anytime, and Marcy or Jen would reply in like at least a couple of weeks. And they were very, they were friendly even during the interview process. So, like, a typical interview, you're going there nervous, you don't know these people, they don't know you, and you're trying to be your best.
Yeah.
And you have all these thoughts in your head, right? But with Colorado, they were trying to make me feel as relaxed as I possibly could. So that was one of the main reasons why I chose Colorado over another school where I was accepted. The other thing was I knew some past students in Colorado, and these were not people I knew from way back when. These were people I networked with and met in the process. So these were people I met during campus visits, during the ADIA recruitment fairs, and things like that. So I kept in touch with them since then. So that was a great way to see how the school was also handling this whole COVID situation and what they were doing to help their students. One of the things which stood out was apparently the faculty had a Zoom meeting with all the students just to ask how they're doing mental health wise.
Oh my God, that's so nice.
Yeah, so just seeing how much they care about their students was what made me want to join Colorado.
I really am thankful for your very honest opinion. And I feel, based on what your experience with Colorado is, and I went to school at BU and I had a very similar experience. So I feel everyone who is listening to this or, looking at a video, please do your research, as Dr. Alisha said, and I actually heard it at one of the conferences which I attended with my husband, and it had nothing to do with dentistry. And the gentleman said, your network is your net worth. So basically, like Dr. Alisha said, she networked with people, she spoke to people. And I feel sometimes what happens is when we are talking to somebody, the first question, unfortunately, we ask, oh, so how much was your GPA? What did you do? But I feel instead of going that route, because everybody is unique, their experiences are unique, the circumstances are unique. And I think that is what the school also looks at. They will never put everybody in one category. They look at each application individually. And I feel that is a great take home message, that please network with people and try to learn something new from them. What are your thoughts, Dr. Alisha?
I absolutely agree because the main thing with networking is that you know things and you find out things about the school, which usually isn't on their websites or on the internet, right? So that would also help you during your interviews. When they ask you questions like why choose our university, you can actually give them specifics on why you're choosing that university. So that way, that's helpful. And you can also get a sense of class cultures. Are the students or classmates going to be like gunners? So maybe that's where you thrive. So you can then choose a school like that. Is everyone more relaxed and things like that? That then choose that school. because at the end of the day, you're going to be there for 2 to 3 years. So you need to like the school you take.
That is so, so true, which completely makes sense because, it's going to be a new country, um, new environment, new ecosystem, and you want to make sure because these are people, like Dr. Alisha said, you are going to spend good 8 to 10 hours of your day with them. So you'll spend more time with them than you'll spend with your family when you're in school. And, and these are going to be your friends, your acquaintances, or your colleagues, not just now, but for life. So we are at least looking at, a good 30, 40 years of career that's ahead of all of you. So I think, that's really helpful. Um, so that brings me to our next question, which is, of course, equally important, the Colorado interview process. So I understand everybody, has very different experience, and I'm sure there are certain things, because of the privacy, you may not want to share, but if you can just give us like a quick overview of how the interview was, what exams do they have something different, that would be great.
Okay. So our interview day, they usually have it over one day where you have a bench test and your interview. For us, because we had the quarantine situation, ours was a little different. For us, we had one separate day as an interview. And from that pool of applicants who they interviewed, they selected a few more to pass to the next stage, which was the online bench test. And so by online bench test, what they did was everything that they asked at the in-person bench test, they showed us in slides and they asked us to critique it. So someone else's work we had to critique through slides. And it was good because you have to have these basics to develop your hand skills for like a class 2 preparation or a crown prep. And so you had to have that knowledge to even answer these questions. And so that was so preparing for a regular bench test would definitely help for an online bench test as well. The other thing we had was a case discussion. So they showed us a photo and asked us to treatment plan that. So again, as long as you have some kind of experience with treatment planning, that would be good. It doesn't have to be in detail. They did not go into details about it, but just as an overview, what would you do if this patient just shows up in your office? That sort of a situation they gave us. The other exercise we had was basically to test our English skills, and it was very, very easy. It was, so tell me about your favorite person and write about a favorite childhood memory. That sort of questions. It was very general. It was very short, and that was a written exercise. So all in all, it wasn't as hectic as maybe in-person interview was, but it still had its stress levels because there's a Zoom aspect added to that.
Oh,
Yeah.
that I completely agree. With the new normal, I must say that we are trying to get used to. Things are definitely different, but I do like the fact that you mentioned that they want to know you as a person. you know
Absolutely, because the one of the first things they ask us to mention, talk about ourselves, but without talking about our CV.
oh,
So
that is nice.
yeah, so it was interesting because after a point of time, I remember I personally was talking about how I paint and play the bass guitar,
Wow.
yeah, and but that is actually nice because they get to know the student rather than you just repeating everything that was on your CV. So the main thing I would say for Colorado is be yourself. Don't hesitate to talk about your hobbies, what you like, your volunteering experiences. That's important. And your volunteering doesn't even have to be just dental. You can talk about what you do to just help your friends around you. Like for me, I was helping teach one of my friend's daughters during COVID because they were teaching online. So things like that are always good to mention because Colorado is looking for helpful, friendly people. So as long as you're coming across that way, it would help. And be authentic, because if you're not, they would tell you that directly. Yeah.
Yeah, see, that is so good to know. So I think that is one thing which our viewers would love to know, that be yourself, be genuine, be authentic. And the schools want to know, because eventually when you graduate, you're going to be their alumni. So you are going to be their walking ambassadors for life. So they want to make sure that you represent them. So, be yourself, be humble. I think that is one thing, east, west, north, south, wherever you go, people like people who are approachable, and I think that's what I got from Dr. Alisha, that um, be yourself. I know we all are doctors from our home country, but there is a reason it's called practice of dentistry and practice of medicine, because we have to keep practicing, learning new technology. And I remember reading this thing a few days ago, and it said, if you feel you're the only person talking in the room and you're the smartest person in the room, then please leave the room, because you're in the wrong room.
Yeah. Yeah, absolutely. Yeah.
So, Dr. Lisha, I know we did speak about it, that, you chose to do masters because that's something you really wanted to. But what would you tell our viewers who, because I know 3.0 is the minimum GPA in most schools, and, for some reason, because we never know what were the circumstances, when people went to dental school. What is it that you would advise them to work on, so, you know, they at least get an invitation for interview?
Yeah. So again, that's a hard question to answer, because there's no one thing which you everyone can work on to get in.
Correct.
Right? So the way what I would suggest is to look at your entire application. What is missing in your application? Do you not? What are your weaknesses? So is it your TOEFL score? Then work on maybe you know practicing more, trying to speak in English all the time at home, things like that. If it's academic, like a GPA, right? So if it's your academic performance, try to take up some kind of courses and classes and excel in that, so they can see that your GPA, what was there in dental school, doesn't represent your abilities, right? So like, I know my GPA in India was low, and but that was, we had different circumstances like most of us do in India. So that's why, do something else, take on other classes, and try to show that you can excel. So if it's experience, definitely get some either experience in your home country working, or get some experience as like assisting or something like that in the US. Or just talk to dental faculty, talk to, like, you can do preceptorship courses, you can do, there are a number of opportunities. So as long as you just look for opportunities, you will find them. It doesn't have to be one specific preceptorship course or one specific academic program that you attend. It depends on what you're interested in, and what you think, what you have access to, because it could be something that's located in a different part of the country that you can't travel to. It could be something like a financial thing, so you don't have to go, just find opportunities near you. That's the only thing I can say, and then work towards it. The only thing that they want to see for re-applicants, even if you didn't get into any school in your first cycle and you reapply, just make sure that you mention how you improved from your first cycle to the next, because that's something they always look at. What have you done in that 1 year to improve? With COVID now, it's a little more complicated, and schools accept that, they agree, they're understanding. So but even then, there are opportunities like online CEs, where you don't have to go in person, but there are still so many opportunities for you. So try to do those, instead of just worrying that you're not doing anything in this 1 year.
See, that is very, very helpful, because, as you said, that maybe at this point, it may not be the bestest thing to go out and do something, but, you could utilize this time in doing a literature review and publishing a paper, or, just going on, volunteering activities that really don't need you to be personally there. For example, if there are some dental students who need help with a particular subject, and you feel you are an expert in that, or you scored really good in school, you can set up online Zoom classes to help them. And I think these days with YouTube and Instagram, I think sky is the limit. If you and everybody, I 100% believe in this, that everybody has that one unique talent which is only unique to them, and there's nobody else who can do that better than them. So find that unique talent of yours, and as Dr. Alisha said, please do not try to judge yourself and put yourself in one box, because that's not how the school is going to look at you. So if you have people in, when you're interviewing, or let's say from the applicants who all had an MDS or a specialty program, don't think that your application is less or more. You all are sitting on the same table, and there was a reason why you all were invited, and I feel, as she said, do something that interests you. Where there is a will, there is a way. Find ways in which you can help the community. If I think as dentists, something which has been, it's very close to me. One is your oral health related quality of life, and second is maternal and child health. So, if that's something that interests you, write papers on it. Or I think there are so many dental foundations, like there's Colgate Foundation, there's Crest, there's Henry Schein, and we are not getting paid to endorse any of these. So we are just giving you examples that they have a lot of free online CE courses that you can take. So you essentially don't even have to spend money, because we understand application cycle is going, it drains you financially. But there are so many free CE courses that you can take. And especially, I think, one thing the world has changed because of the current situation is that everything is online and it's accessible. So I feel whether you are in the United States or whether you're out of United States, so for something which you had to fly, now it's literally available to you one click.
Yeah.
So thank you so much, Dr. Alisha. I think your experience is going to help so many people. I sincerely appreciate you taking time. I know you have professional and personal obligations, and I dearly, dearly, dearly appreciate. What is that one take-home positive note that you would like to give our viewers?
Just don't give up. It's going to be worth it in the end. You will have sleepless nights. You will have days when you just cry, and all of us have been through that, right? So, and remember that it's worth it in the end. At the end of the day, you're going to get a DDS or a DMD degree. You're going to be working. You're going to be able to support everyone who supported you in this journey. So just think of your final goal and keep moving. Just keep moving. Take care of your health, and just keep doing what you do best.
Thank you so much, Dr. Alisha. And we will definitely bring you some more fun, positive, and hardworking doctors who are going to be future DMDs and who will share their journey with you. Thank you so much, Dr. Alisha. Take care, everyone. Stay happy, stay blessed, and stay safe. Take care.
Take care.